So, hi everyone, my name's David Gregory. I'm a consultant psychiatrist and I've been working with MAC for the last year or so. Before I joined MAC, I was working in the NHS since about 2009 in a range of different mental health services. So it's great to have a chance to speak to you all today about OCD. The most common symptoms of OCD are obviously the obsessions and the compulsions. Obsessions are, people usually experience them as being intrusive and unwanted thoughts that they know are their thoughts, but they don't necessarily have the feeling of having thought it themselves. It's a thought that seems to force its way into your mind, usually repetitively, so over and over again. Most of the time it's quite an upsetting thought. It can be really anxiety provoking or bring up quite difficult feelings like shame or guilt, depending on the thought. And people, particularly early in the experience of OCD, will really try and push those thoughts away, will make efforts to avoid having them, or if they do show up, to try and suppress them in some way. The OCD Awareness Week is a really important campaign because although there are some treatments that help some people with OCD, it still remains a mental health problem that many people suffer with. And even if you do engage with the treatments that are available through the NHS at the moment, there's a fair number of people that continue to experience symptoms and who don't have that improvement in their quality of life that they would really like. So although many people do find that the existing treatments like cognitive behaviour therapy, exposure and response prevention, or medication treatments like with the selective serotonin reuptake inhibitors, that they can get some benefit from those treatment options, it is still true that a lot of people don't get the level of relief that they would like from their therapy. And I think one of the reasons for that is that the underlying causes of what's going on in obsessive compulsive disorder, they're not fully understood. So that means the treatments that we offer are based on still a developing understanding of what OCD is and how it's affecting the body and the brain and the mind. But I think it's really quite difficult to predict what the course of OCD will be like for any one individual person, because there are a number of different ways that OCD can change and develop over the years for people. It is true, unfortunately, that some people, particularly if they develop OCD earlier in their life, OCD may be a sort of theme that they're learning to live with and seeking help for many, many years. But then equally there are other people who may have OCD for a period of time, and either through successful treatment or just through changes in their life or as they're growing older, OCD becomes much less of a problem, or it may even remit completely and go away on its own. And then there are other people who experience more of a sort of episodic course to their OCD. So they may have episodes of OCD following really stressful periods of time in their life, a period of time with no OCD symptoms, and then the OCD may come back again at some stage in the future. So it's really difficult to predict what pattern OCD will take for any one person. Here at MAC, it's really important to us that every participant that takes part in our studies experiences their time with us as being comfortable, supportive, non-judgmental, and a manageable experience for them. At every stage in the journey through a clinical trial, we really would encourage you and reach out to you to talk about any worries that you have, things that you're concerned about, and if there is any possibility to make adaptations to the way we do things so that you feel more comfortable, we 100% will explore that with you and do what we can. So if you decided to take part in our OCD study here at MAC, you'd be asked to take either the active medicine troriluzole, which is an oral medicine given as a tablet, or a placebo, and that means an inactive drug, which will look and taste exactly the same as the active medicine. Taking that every day for 10 weeks, and during that time coming into sites for a clinic visit on 7 occasions to go through a series of assessments of your mental health and the level of OCD symptoms that you're experiencing over that period of time. Once you've completed the 10-week period of the main study, some people may be eligible to continue in the open label extension part of the study, which would involve continuing to take the medicine for up to 48 weeks.